Hello everyone, my name is Shanmas Jua Baldivia and I am a nursing student from Nunescost. Um, and I am going to perform the wound care. Definition. Wound care is a aseptic cleaning of wounds. Assessment. Assess the situation to determine the need for wound cleaning and addressing change. Confirm physician orders relevant to wound care included in the nursing plan of care. Assess if the patient experienced any pain prior dressing changed and what interventions employed to minimize the patient's pain. Assess the current dressing to determine if it's intact. Assess for excess drainage or bleeding or saturation of the dressing. Inspect the wound, uh, Inspect the wound and surrounding tissue. Assess the appearance of the wound for approximation of wound edges, the color of the wound and the surrounding area and signs of dehiscence. Note the stage of the healing process and characteristics of drainage. Assess the surrounding skin for color, temperature and edema and ecchymosis or maceration. Objectives: to promote fast wounding healing, to remove debris, damaged cells, to prevent bacterial growth and complications. General considerations. Methods of wound care. Open wound, wound care without the use of dressing. Closed wound involves the application of a dressing. Equipments. Dressing tray containing the following: sterile gloves, gauze dressings, sterile dressing set or suture set, sterile cleaning solution, clean disposable gloves, sterile basin, sterile drape, plastic bag, waterproof pad and bath blanket, tape or ties, Surgi pads or ABD pads. Additional dressings and supply needed or required. Okay, step 1, review physician's order for wound care or the nursing plan of care related to wound care. Reviewing the order and plan of care validates the correct patient and correct procedure. Step 2 is gather the necessary supplies, of course. Preparation promotes efficient time management and organized approach to the task. Number 3 is identify the patient. This ensures the right patient receives the right intervention. Number 4, explain the procedure to the patient. Discussion and explanation help allay anxiety. Encourage patient cooperation and prepare the patient for what to expect. Step 5 is assess the patient for possible need for non-pharmacologic pain-reducing interventions or analgesic medication before wound care dressing change. Administer appropriate analgesic, consulting physician's order and allow enough time for analgesic to achieve its effectiveness. Pain is a subjective experience influenced by past experience. Wound care and dressing changes may cause pain for some patients. Perform hand hygiene, of course. Close the room door or curtains. Place the bed at an appropriate and comfortable working height. Closing the door or curtain promotes privacy. Place a waste receptacle or bag at a convenient location for using during the procedure, of course. Having a waste container handy means the soiled dressing may be discarded easily without the spread of microorganisms. Ask, ask the patient to a comfortable position that provides easy access to the wound area. Use the bath blanket to cover any exposed area other than the wound. If necessary, place the waterproof pad under the wound site. Patient positioning and use. Bath blanket provide for comfort and warmth. Waterproof pads protects underlying surfaces. Check the position of drains, tubes, or other adjuncts before removing the dressing. Put on clean before removing the loosened tape on old dressings. If necessary, use an adhesive remover to help the get tape off. Checking ensures the drain is not removed accidentally if one present. Gloves protect the nurse from contaminated dressings and prevent the spread of microorganisms. Adhesive tape removal should, of course, it helps reduce patient discomfort during removal dressing. Step 11 is carefully remove the soiled dressings. If any part of the dressing sticks to the underlying skin, use small amounts of sterile saline to help loosen and remove. Do not reach over the wound. Cautious removal of dressing is more comfortable for the patient and ensures that any drain present is not removed. Sterile saline provides for easier removal of dressing and prevents tissue damage and minimizes pain. After removing the dressing, note the presence, amount, type, color, and odor of any drainage on the dressings. Place soiled dressings in the appropriate waste receptacle. Remove your gloves and dispose of them in appropriate waste receptacle. The presence of drainage should be documented. Proposal disposal of soiled dressings and used gloves prevents spread of microorganisms. Inspect the wound site for size, appearance, and drainage. Assess if any patient is present. Check the sutures, sterile strips, staples, and drains or tubes. Note any problems to include in your documentation. Wound healing or the presence of irritation or infection should be documented. Using sterile technique, prepare a sterile work area and open the needed supplies. Supplies are within easy reach and sterility is maintained. Open the sterile cleaning solution. Depending on the amount of cleaning needed, the solution might be poured directly over gauze sponges over a container for small cleaning jobs, or into a basin for more complex or larger cleaning. Sterility of dressings and solution is maintained. Put on sterile gloves. Use of sterile gloves maintains surgical asepsis and sterile technique and reduces the risk for spreading of microorganisms. Clean the wound if needed. Use sterile forceps to the clean area. Clean the wound from the top to bottom and from the center of the outside. Following this pattern, use any gauze for each wipe, placing the used gauze in waste receptacle. Do not touch any surface with the gloves. Cleaning occurs from the least to the most contaminated area, or from top to bottom. Using single gauze for each wipe ensures that the previously cleaned area is not contaminated again. If a drain is in use, clean around the drain using a circular motion. Wipe from the center toward the outside. Use the gauze a single time and then dispose of it. Cleaning occurs from the least to the most contaminated area. Once the wound is cleaned, dry the area using a gauze sponge in the same manner. Apply ointment or any other treatments if ordered. Moisture provides a medium for growth of microorganisms. The growth of microorganisms may be retarded and the healing process improved with the use of ointments. Apply a layer of dry sterile dressing over the wounds. Forceps may be used to apply the dressing. Primary dressing serves a wick for drainage. Use of forceps helps ensure the sterile technique is maintained. Place a second layer of gauze over the wound site. A second layer provides for increased absorption of drainage. Apply a surge pad ABD dressing over the gauze at the side of the outermost layer of the dressing. This dressing acts as additional protection for the wound. Against microorganisms in the environment, remove the discard sterile gloves. Apply tape or tie tapes to secure dressings. Tape is easier to apply after gloves have been removed. Proper disposal of gloves prevents the spread of microorganisms. After securing the dressing, label dressing with date and time. Remove all remaining equipment. Place the patient in a comfortable position with side rails and up with the lowest. Perform hand hygiene. Recording date and time, communication, and demonstration adherence to planned care. Proper patient and bed positioning promotes safety, and hand hygiene prevents the spread of microorganisms. Check all the wound dressings every shift. More frequent checks may be needed if the wound is more complex or dressings become saturated quickly. Checking dressings ensures the assessment of changes in patient condition and timely intervention to prevent complications. Evaluations. Client demonstrate progressive healing of wound as evidenced by the following. Wounds edges closing together, reduced swelling and redness of the wound's edges, reduction in amount and color of drainage, decreased wound pain. Client remains free of infection with normal temperature (VBC), absence of wound swelling, odor, and purulent drainage, and no increase in pain. Client practices self-care behaviors to promote healing by the following. Washing of hands appropriately, keeping hands away from the wound drainage, and dressing. Maintaining a well-balanced diet as ordered. Client demonstrates understanding of wound and dressing care. Documentation, time of dressing and change the type of dressing. Amount, color, consistency, and odor of the drainage. Specific assessment parameters including condition of skin, drain, site, and incision line. The patient's reaction to the procedure including any pain experienced.